Fabulous. Well, it's so lovely to have you all here today. And a great big welcome from us at the Go Lab. This is our Engaging with Evidence session, all about looking at impact, value for money, in two different contracting models. So the more traditional fee for service model and an outcomes-based contract. So if this is not what you're expecting to be at, this is your chance to leave the session. Hopefully this is the session that you expected to be attending. John, would you mind hopping to the next slide, please? So, for most of you will probably already know the Go Lab, as we call ourselves, the Government Outcomes Lab. But for those of you who are newer to us, we are a research centre of expertise based at the Blavatnik School of Government here in Oxford, at Oxford University. And our aim generally is to help with cross-sector partnerships, so different sectors partnering in a meaningful and impactful way, particularly looking at how that can drive better outcomes, like social outcomes. And there's a lot more you can find out about us through the QR code that's currently on the slide if you go on our website. But I think maybe the most helpful thing to know about us today is that we were originally set up in partnership with the UK government back in, I think, 2016. And the point of this partnership was so that we could have a look at what is the evidence around outcomes contracting, social outcomes partnership. So this way of working where there's a real emphasis on measuring and paying for outcomes. And from that, we've then done this whole host of research, which one of the outputs of that is what we're looking at today. And for those of you I haven't had the pleasure of meeting before, my name's Jess. I'm the Senior Policy Engagement Officer here at the Go Lab. What on earth does that mean? Well, most of our team are traditional hardworking academic researchers, as you'd expect of Oxford. But I get the really fun job of taking that research, those insights, and trying to help them reach the people who can use them. So people doing practice, policy, so writing policy briefs, running events like this, doing a lot of that translation and knowledge sharing piece, which this is very much a part of. And one of the things I do is host this series called Engaging with Evidence. Can we go to the next slide, please? And for a fair number of you that I can already see, you'll be very familiar with the Engaging with Evidence series. But for those of you whose first time it is today, a massive welcome. This series, the whole point of it was that we wanted to create a space for sort of peer learning in an interactive way where you can delve into what is the latest piece of research and then having an interactive Q&A discussion around that. And that research might be ours, but we also host it for other people. We do this in a really open forum, so anyone's welcome to come. That means our audience is really diverse, which is really exciting. And we just want to dive into then like the practical insights and experiences across sectors and different fields from that and have an honest and open dialogue about it. So we encourage people to bring your experiences, your perspectives to your questions, and to use the chat slots. And that whole series is based around this. And this one happens to be a piece of Go Lab's research this time. So we're particularly excited for that. And maybe a brief thing on housekeeping to say that we'll start with a panel. Well, sorry, we'll start with a presentation, and then we'll spend most of the time doing more of a panel Q&A. The presentation is by the authors, my colleagues, of the report. But during that, please do use the chat to put in your questions, because we'll come to this Q&A time where you can be able to use the raise hand function, but you can also, I'll be taking questions that have come up from the chat throughout. So please, yeah, use that, get your questions in throughout. Next slide, please. Our audience this morning, I promised it'd be interactive. I wanted to take a moment just to pause to invite you all to introduce yourselves in the chat, where you're from, where you're based at the moment, what work you're doing. It can just be a sentence. But I will be quiet for a moment while I encourage you all to introduce yourselves. Hi Al, hi Felix, hi Stuart, Andrew, Kirsty, Paul, John. Great to see you. Hi, Eileen. Hi, Warren. I've already complimented your book background. Hi, Duncan, Hattie, David. Guys, keep introducing yourselves. It's so lovely to see you all, and we're really looking forward to having this session with you today. Next slide, please, John. Do keep introducing yourselves in the chat. It's really nice to get a sense where everyone's joining from. So to be able to get the most out of today's session, I wanted to just quickly, very, very quickly, do an explanation of a few key terms that will be coming up. If you have any other questions as the session goes on, again, pop it in the chat. I'll try and answer it, or maybe one of my colleagues will have a go at answering it too. But just to level the playing field, some of you will know these terms inside out. Some of you will be less familiar with them. The first term that will probably come up today is social outcomes partnership. I've already mentioned them, or outcomes-based contracting. In short, that's SOP, yeah, weird sounding thing, or OBC. A social outcomes partnership is the exact same thing as a social impact bond, if that's language that you're familiar with. So please don't get confused by those two different terms. But the key thing that you should know about this is that it is a form of partnership, normally across sectors, where typically it does vary a lot. There are two defining factors that we see. The first thing is that there's payment attached to outcomes achieved. So outcomes are being measured in this partnership in a really close, tangible way. And then some payment, maybe all payment, it can vary, is tied to that. And the second factor that we often see is that there's some sort of private sector upfront investment, although actually that investment can come from a number of different players, especially in different contexts across the globe. So that's broadly what it is. I think the main thing to remember there is it's a way of working with an emphasis and a focus on outcomes, and payment tied to outcomes and measurement are all around outcomes, as opposed to just money going towards a service without that really close measurement and tie to that. Second term that might come up today, if you read the report, it will have come up a lot there already, or if you go on to read the report, this will set you up well for it. But it's fee for service. A fee-for-service model is how most services from government are typically done. So that's where you pay money, a fee, for a service to be delivered. So that would be in contrast to something like a social outcomes partnership, where government would instead pay for outcomes being achieved rather than just straight up for a service, regardless of those outcomes. And then the final term that actually my colleagues will go into explaining a bit more, but I will say in very brief, is the Kirklees Better Outcomes Partnership, which we call KBOP. And the Kirklees Better Outcomes Partnership, in a very simplistic way, is a project that's a social outcomes partnership. So one of these partnerships between organisations measuring outcomes, that's based up in Kirklees in Yorkshire. That is the project that we're really looking at today. But I know that my colleague Elle, I think, will be explaining a little bit more what on earth that all means shortly. But hopefully those three terms will level the playing field a little bit, sets you up well for the conversation to come. And without further ado, I'm going to ask John to pop the slides down for a second so I can see all your lovely faces. Brilliant, you're all here. And we're going to hand over to our presenters now. Elle, I believe you'll be coming first, and I'll invite you to introduce yourself. And then Maria, when you go to present, maybe you can introduce yourself as well. But please do use the chat for those questions. Let us know if you have any difficulties. We're on hand, and we're really keen that this is an enjoyable and understandable session for all of you. Elle.
Thanks so much, Jess. Welcome and thank you for joining us, everyone. My name's Elle Carter. I'm Academic Director for the Government Outcomes Lab in the Blavatnik School of Government at the University of Oxford. So many of you on the screen have supported this research. It has taken a great effort and a fair amount of time to put together. So I've got quite an excited feeling about sharing the findings with you today. I will ask John to put up my slides. So we're talking about the Kirklees Better Outcomes Partnership, which we affectionately refer to as KBOP. It's really fantastic that we're joined by Sarah Cook, who is Managing Director of KBOP today. And I suppose we use KBOP as a bit of a shorthand for three things. So I wanted to describe that because we use KBOP to mean a service, a partnership, and also an ethos or an approach. So I just wanted to take a moment to get you a bit more familiar with KBOP before we talk about the findings. So on our next slide, John, thanks. So KBOP as a service is a service that aims to secure better social outcomes for disadvantaged residents across the local authority area of Kirklees. So for those not hot on West Yorkshire geography, this is Huddersfield and the surrounding towns. Importantly, it's not actually framed as an employment support intervention. It's a housing related support service, but people might actually come into contact with the KBOP team through a range of different experiences. So people might be referred because they're experiencing homelessness or they're facing the immediate risk of becoming homeless. Participants might be experiencing multiple challenges. That might be mental health or substance misuse issues. It could be the experience of domestic violence. It could be offending experiences. So access in terms of those eligibility criteria is really intentionally very broad. And as a partnership, and Jess explained that KBOP is a social outcomes partnership. It's been co-funded through the Life Chances Fund, and that means that funding is linked to specific, pre-agreed and measurable outcomes. So KBOP is a new-ish partnership coordinating organisation, and the launch of KBOP in 2019 brought the delivery of services from multiple not-for-profit delivery organisations under a single outcomes contract. So payment through that is tied very explicitly to the achievement of measured outcomes. It's Kirklees Council that commits to pay for these outcomes that are set out in a rate card. And it is quite a flexible range of outcomes. It includes things like entering and sustaining accommodation, but also well-being, training, volunteering, and employment. Also important to note that the service provider organisations are not themselves exposed to the outcome performance payments. That risk is held by KBOP. So we've, as a research group, been following this outcomes partnership over time. There's a longitudinal process evaluation that we've also been developing here. And that has really helped us to understand KBOP as an ethos. And the image that's on your screen now begins to try and capture something of the KBOP approach. Because KBOP takes an asset or a strengths-based approach. It means listening deeply to the person participating in the service, and putting their aspirations and their strengths at the heart of support. So you can see on this image that this was prepared as part of a peer research exercise. So people who had previously participated in KBOP then were acting as mentors within the service and as researchers in this project, and tried to visualize what this service feels like. And on the left-hand side, you can see this in contrast to more conventional services, where you see terms like traumatizing, stigmatizing, deficit-based. In contrast, on the right-hand side, how the KBOP support felt, drawing on someone's assets and strengths. The quality of the conversation between participants and their caseworkers or key workers really comes to the fore. So trust is emphasized, genuine empathy from people with lived experience is drawn out. The credibility was often commented on of when your caseworker really gets it, and the assurance and flexibility of dealing with actual problems. So as a team, GoLab have been evaluating KBOP since before it was launched as an outcomes partnership. And that means that we've got really detailed records of how things have evolved over time. So we can signpost you to our process evaluation. And in addition to this mural, we also have a peer-reviewed academic paper that finds a real increase in person-centeredness amongst caseworkers over time under KBOP. But we know that there are appetites for different forms of evidence amongst different communities. Murals can be striking and compelling for some. Others might look for peer-reviewed work. But really, particularly amongst Treasury and Cabinet Office audiences, there's a very big emphasis on quantitative impact evaluation and economic analysis. And that's what we're going to be discussing today. So, John, on my next slide, I'll have a moment to think about, why does this study matter? So it responds to two big evidence gaps. There's a gap in the evidence around the effects of outcomes partnerships compared to more business as usual commissioning practices. So there's a lot of energy amongst the social outcomes partnership community, but also a looming question. How do these partnerships actually stack up against more conventional ways of funding public services? Are they more impactful? Are they cost effective? And this has been looming for some time, and it's taken us an awful long time to be able to answer this question. But this is the first study in the UK to really be able to answer that question. So it's a big first step in responding to this social outcomes partnership effect. Many will know that I've described this as the donut challenge in terms of evaluation, because a jammy British donut, because most policy evaluation work centres on the specific frontline intervention or service, the jam, the sticky jam. But here, the focus of our evaluation is the commissioning and contracting structure. How are we holding services to account? How are we funding and resourcing them? And we want to investigate the ways in which organisations are held to account, so the doughy scaffolding rather than just the jam. And so Kirklees is a fantastic evaluation opportunity because we have a very similar jammy service over time. So Maria will share more of the details of the legacy housing support service, but effectively we can see the change in the dough because we go from a fee-for-service arrangement to an outcomes partnership arrangement, and we're able to follow that over time. And the second evidence gap is around understanding employment support. So the Department for Work and Pensions, DWP, and Treasury want to build a more prosperous society by supporting people into work and helping people realise their potential. That's what all the policy documents say. But there's actually a crucial evidence gap around support that's effective for people who are seen as maybe a bit more distant from the labour market and who might be experiencing multiple compound barriers and disadvantages. So this DWP areas of research interest crystallises all the questions that are lingering for the department, and the department asks what types and combinations of support are most effective at enabling people to move into or closer to sustainable work, particularly those with complex barriers to employment, for example, ex-offenders, care leavers, those with drug and alcohol problems, people with mental health conditions. So that's what the policy teams are really asking to understand more about, because we know that mainstream employment support does really not work well for people experiencing these kinds of disadvantage. But the evidence around the best alternatives is not actually that clear. So the labour market evaluation pilot was then a perfect opportunity to respond to this double evidence gap. So we're trying to answer this kind of outcomes-based partnership effect, and we're also trying to better understand the types of support that might be valuable for enabling employment outcomes that are different to more conventionally configured support services. And now I'll pass to Maria to explain the real nuts and bolts of our methods and our findings.
Thank you, Al, for setting the stage, and thank you everyone for joining us. I'm Maria, and I'm a quantitative researcher at the GoLab, and I will be walking you through our evaluation approach and our findings. So the first question that we focused on was impact. So we asked whether this asset-based support model, commissioned through an outcome-based contract, as Al just described it, led to better employment and housing outcomes for participants compared to the legacy services that we replaced. And I will be referring to those legacy services as pre-KBOP. So to answer this question, and could I have the next slide, John, please? Thank you. We collected local management information from KBOP and pre-KBOP as well, and we linked this information to a unique UK government administrative dataset from the Department of Work and Pensions. So in practice, this meant that if there was a person, and let's say it's John Smith, who received the legacy service, then the nonprofit providers were able to give us his name, his date of birth, and his national insurance number. And using these personal identifiers, we could match him to his government records inside DWP. And this allowed us to understand John Smith's benefit history, current benefit claims, past and current labor market status, his housing benefit receipt history, and demographic information such as his number of children, gender, age, and so on. And by collecting this information for both the KBOP and the pre-KBOP participants, we built a long-term individual level data set that allowed us to track people's labor market and housing trajectories over time. Next slide, please. So with this rich data set, the next step was to work out exactly what difference that it was that KBOP made to the participants compared to the business as usual service. And to do that, we needed to compare people in similar circumstances. So we built a like-for-like comparison group from people in pre-KBOP and KBOP. So essentially, we matched KBOP participants to pre-KBOP participants who looked very similar at the point in which they came into the support. So for example, they had the same age, gender, recent work history, and benefit history. So at the end of the day, we ended up with two groups of people who arrive at the services with broadly the same characteristics. And then the only difference is that one group received the legacy support and the other group received the KBOP support. And then we tracked both groups for 2 years to see their employment and housing benefits and how they unfolded. So we can turn to our findings now. And let's focus on employment first. The numbers we present, let me highlight first, the numbers that we present here show the average change in participant outcomes for those that receive the KBOP support compared to the business as usual. So across all employment measures, the results point at the same direction, that KBOP participants did better than those in the legacy service. For some outcomes, the differences are statistically significant. So in other words, the data give us high confidence that these improvements are genuine. And for other outcome measures, the effects are still positive, but the effect is not yet strong enough to be definitive. Overall, we observe an early and significant effect. So within 6 months, KBOP participants were 3 percentage points more likely to enter or sustain work. And that advantage persists. So KBOP participants are 5 percentage points more likely to be in work in year 1 and 6 percentage points to be more likely in work in year 2 after they joined the KBOP service. Both effects are statistically significant, indicating that there is a sustained engagement with the labor market. Also, participants were significantly more likely to be in employment for up to 6 continued months by approximately 5 percentage points compared to the pre-KBOP participants. When we look at the differences in the total number of days worked over the follow-up period, the results are positive, but they're not statistically significant. And earnings follow the same pattern. So average earnings were about £500 higher in year 1 and £400 in year 2, but these differences are not statistically significant. So in summary, we find clear effects on job entry and short-term retention with no conclusive evidence yet of the higher total days worked or higher pay. And turning into the housing outcomes, our results provide a strong indication that KBOP improves housing-related outcomes for the participants. To provide some context before delving into this, the housing element of universal credit, what we refer to here as UC, is now the main form of housing support for working age adults who have housing, but they struggle with their rent. And housing benefit, by contrast, is largely reserved for people of pension age or for those who are in supported, sheltered, or temporary accommodation. And during the period that we examined, many claimants naturally moved from the housing benefit onto UC as part of natural transition onto the universal credit. And as a result, both cohorts saw rising UC receipts and declining housing benefit receipts over time. And within that context, we observed that KBOP participants were 6 to 10 percentage points more likely to remain off universal credit for up to 18 months. And these differences are statistically significant at every interval. So this indicates a reduced reliance on housing-related welfare support. And a natural follow-up question was why participants stopped receiving UC. And one possible explanation is that their financial stability improved, which is consistent with the positive but not very definitive earnings patterns that we observed. So to ensure that participants were not simply moving onto from UC onto housing benefit, we examined a more strict composite measure that required individuals to both come off UC and not transition onto housing benefit after. And here too, the results were positive. So CABO participants were significantly more likely to remain off both UC and housing benefits throughout the follow-up period. So when the receipt of housing benefit is examined on its own, the difference between KBOP and pre-KBOP participants is not statistically significant. And next slide, please. To understand better how those impact effects that we observe may vary across the population, we also examined key demographic subgroups. And then we have three patterns that stand out. First, the employment effects are strongest for adults aged 63 to 36 to 65, people who had been unemployed throughout the previous year before coming into the service, and for those with past mobility or daily living benefit claims, and that would be personal dependence payments and disability living allowance payments. And also, notably, only the 36 to 65 group shows a statistically significant increase in the total number of days worked over the past 2 years. Secondly, on housing, reduced reliance on the universal credit housing element is widespread and statistically significant across many groups, with particularly pronounced reductions for younger adults, women, and long-term universal credit claimants. And third, it should be mentioned that not every group moves in the same way. So the variation that we observe is consistent with a person-led model and the participants' diverse needs as well, shaped by the very broad eligibility criteria that KBOP had and the differing life circumstances. And this is in a very small snapshot, the impact evaluation. And we can now turn into the economic analysis. So the second question that we asked and we want to understand was whether KBOP represents good value for money. And this round of work was led by a brilliant colleague, Dr. Elaine de Gruyter. So in theory, the task should be straightforward. We had impact estimates and we also had information on program costs. But in practice, this was more demanding. We had to work through a number of methodological choices before we could reach a robust value for money judgment. There are a number of ways in which you can undertake such an assessment. And in this case, we opted for a cost effectiveness analysis because our impact metrics span both monetary units, so essentially the earnings, but also non-monetary units, time and employment, and housing benefit receipts. And we had to address several analytical considerations. The first one being that we had to construct the pre-KBOP and the KBOP group slightly differently than the impact evaluation. So for the impact evaluation, the KBOP group includes participants who received the fully implemented person-centered and asset-based model of support once the new way had bedded into KBOP, and we estimated this happened in July 2021. But for the value for money analysis, we needed to capture all the costs from the start of the outcome-based contract. So the KBOP group includes everyone who started receiving support from the contract launch in 2019. Second, the pre-KBOP and the KBOP models served very different numbers of participants. And to keep the comparison fair, we had to express all the costs and all the impacts on a per-person basis. Another important point is that the UK international guidance generally recommends the value for money analysis being conducted from a societal perspective because it captures wider welfare effects beyond public budgets. But due to data constraints, we had to adopt a more limited government perspective instead. So the perspective of a government commissioner aiming to maximize impact for employment and housing outcomes within a budget constraint. And this is also very well supported in the literature in such cases and is highly decision relevant. And last, KBOP was a relatively new reform, and also the Life Chances Fund itself was a very new reform in the UK context. So we want to understand how much of the cost might relate to this being a new program. So we conducted an extensive sensitivity analysis to test alternative scenarios. And then we can see the cost assessment framework that we developed. Thank you. So we defined three key cost categories based on the activity types. First, we had the intervention and service costs. These were relatively straightforward to collate, drawing on pre-KBOP contract values and the commissioner payments made under KBOP. Second, we had transaction costs. These cover the cost of setting up the contract, so research, negotiation, legal work, and design, as well as the ongoing costs of governance, monitoring, evaluation, and delivery oversight. Social outcome partnerships are often criticized for being very expensive, and yet very few studies have actually measured these transaction costs. And we estimated them through semi-structured interviews with local and central government stakeholders. And the third group that we looked at was the additional relevant costs that we tried to identify through the same interviews, ensuring that we captured any and all cost elements that were not covered in the first two categories. And in the next slide, we can see the total cost associated with pre-KBOP and KBOP reported in real 2014 pounds. So looking at the graph on the left, KBOP costs more overall, so 23.3 million compared to 17.8 million in pre-KBOP. And this is driven by the higher intervention and service costs and higher transaction costs. If we zoom in on the transaction costs, so the orange bars on the right-hand side, and then we look at the right-hand side, we can see that under pre-KBOP, all transaction costs were borne by local government, so the Kirklees Council. And under KBOP, local government transaction costs remain slightly decreased, but two new cost categories appear. So we have central government costs and evaluation costs. However, there is a very crucial point that KBOP served nearly double the number of participants. So when we look at the per person costs, KBOP is actually much cheaper. So pre-KBOP cost per person is 3,200 approximately, and in the pre-KBOP cost per person is 4,800 pounds approximately. So essentially, we see a reduction of about 33% per person. So is KBOP value for money? If we could turn to the next slide. So yes, it is. We find that KBOP is less costly and more effective than pre-KBOP across all outcomes. And for those who want the technical detail, the incremental cost effectiveness ratios are here in the table. And for those who prefer more technical and more easier interpretation, we see that for every pound of earnings per person, the KBOP costs 46 pence less per person. For every additional month in employment per person, KBOP costs £639 less per person. And for every additional month reduction in housing benefit received, KBOP costs £510 less per person. And these results are driven by KBOP's higher number of participants and the improved outcomes, despite the higher transaction costs. And there are a few points to highlight when interpreting these findings. John, if you could please turn to the next slide. Thank you. So the first one is that the two models have a very different scope. So pre-KBOP focused primarily on housing-related support, whereas KBOP is more holistic, encompassing employment, education, financial literacy, well-being, and volunteering as well. Second, the two models define success differently. So our analysis draws on the Department for Work and Pensions administrative data, which only captures outcomes that appear in official government records. But KBOP, however, places value on earlier stage and qualitative progress as well. So, for example, someone who had been housebound, beginning to leave the house regularly or doing unpaid walking of a dog once a day. And these are first steps that are meaningful, but they're not visible in administrative data sets. So unfortunately, they're not reflected in those quantitative results. And there are also some limitations to bear in mind when looking at this analysis. So first, we only have 3 years of impact data. At the time of the analysis, the WP only allowed us to track outcomes through the 2024 financial year. And this means that we couldn't assess whether the observed impacts on employment and housing persist over the longer term. We're also unable to examine monthly earning patterns, undertake further robustness checks due to limits in both time and data. So the earnings data was only available annually, which makes it difficult to detect short-term changes or earnings growth over time, particularly where program starts did not neatly align with the financial year reporting. Also, we cannot account for differences in economic or labor market conditions between the two time periods. So due to data and time constraints, we're unable to implement some of additional evaluation methodologies that would have allowed us to better separate the effects of the interventions from the wider changes in the economy or the policy environment, such as COVID-19. But to help us mitigate this, we focus our analysis on participants who entered KBOP after the COVID-19 restrictions were lifted in July 2021, aiming to capture outcomes in a more stable post-pandemic context. And also the incremental cost effectiveness ratios are based on aggregate costs, so we do not apportion costs to individual outcomes. So this is a snapshot of the value for money analysis. And essentially, our conclusion is that KBOP delivered better outcomes for participants at a lower cost in a very short one-liner. So we're open to any questions you may have, and I'm going to leave it there because I've been talking for a while.
Thank you so much for that, Maria and Elle. That's really, really brilliant. And I do encourage you all to take a look at the full report. As was alluded to by Elle, this is, I think, to our knowledge, the first study to really be able to get at some of this in the UK. So it's really, really exciting, and it's something we've been working really hard to be able to get at. There are, of course, some sort of nuances and limitations that are worth bearing in mind. This is us looking at one specific social outcomes partnership, but it's still quite exciting data to be able to get. So we've got some time for questions, and I think we'll probably take some initially to do with the presentation that Elle and Maria just did, and I see that we've already got some questions coming in the chat, which is brilliant. But we're also now going to be joined by a brilliant panel of experts too. So I'm going to briefly introduce them as well. We'll then take some questions about the report, but then we'll pull this out into our wider conversation. So our first person who has now joined us on the screen for our panel besides Elle and Maria is Sarah Cook. Sarah Cook, as Elle mentioned, is a good friend of the Go Lab by this point and is managing director at the Kirklees Better Outcomes Partnership that we just talked about. Sarah, do you want to just very briefly introduce yourself for everyone?
Yeah, hello everyone. Lovely to be here with you today. As Jess said, I'm the director of KBOT and love everything about what we do and everything about the changes that we've implemented, and very much enjoyed working alongside GoLab to look at the impact of our new way of working.
Great, thank you so much. So Sarah, we're really excited to have on the panel because I think she'll really be able to speak to on the ground what this intervention looked like and felt like. So if you have questions like that, we really, really welcome them. And then the second person who I want to invite to introduce themselves is David Johnson. David is the head of poverty policy at the Department for Work and Pensions, so DWP. And crucially, he was really involved in making this analysis possible and making this research possible, giving us access to the data and really being a champion. David, do you want to briefly introduce yourself too?
Thanks, Jess, and good morning, everyone. Well, you've already introduced what I do, so head of poverty policy in DWP. I'm sure we'll talk about it in a bit, but a lot of my role in the KBOT project was the kind of coordination of the government input to it, whether that's on the funding, the business cases, getting access to the data, QAing the analysis, that kind of function. And it's great to be here, and it's lovely to hear the results of the KBOP. Again, I've heard this presentation before, but I always forget actually how positive the project was, which is really great to see. Thanks.
Thanks so much. Okay, great. So the chat is already in use. Warren, if you're happy to unmute yourself, can I invite you to ask your questions to the panel? Otherwise, I can read them out if that doesn't work for you.
Hi, yes, has that worked?
Yes, brilliant.
Okay, doke. It was just interesting in that I take the point about the overall cost of the model, but then just understanding what was it that drove the increase in the participants and whether that was actually a positive effect, because what you were doing was uncovering unmet need, which actually is probably an output of a more preventative model. And then the second thing was just whether that overall saving on employment related and housing related welfare costs ultimately offset the additional cost of the model, which feels like a fairly kind of conclusive point. And then because Sarah's on, if I could kind of cheekily ask as well, I'm just thinking of whether there is anything that you've done locally in terms of the impact on staff working in this way and in this model. That I think a gut feeling is this is a better way to work, but I just wondered whether you'd done anything on that as well. Thanks.
Thank you. Maria and Elle, let's go to you first, and then we'll go to Sarah afterwards.
Thanks for those questions. And Sarah, I'm sure we'll be able to give more detail on this. I think there are a few things that are probably underlying the elevated number of participants in KBOP. And this is something that we've detected more through our qualitative process evaluation rather than the quant impact work. KBOP is certainly better known on the ground. There's much more proactive outreach. And so the number of people who are connected has certainly gone up over time. There's also been quite a change in terms of the emphasis and what staff value and pay attention to compared to the legacy fee-for-service arrangement. We detected a little bit of, well, not just a little bit, actually, a fair amount of competition for referrals between some of the not-for-profit delivery organisations in the legacy service and a much more coordinated partnership model under KBOP. So there was less of sort of scrapping it out for a particular number of local participants in the legacy services, much more proactive outreach, and so just larger numbers of people coming into contact with the service. There's also a sense that the intensity of the service flexes around people much more in KBOP. So the service specification of old used to have a very fixed duration and people would stay on the service for the fixed duration. But now we've got much more variability, and sometimes participants are having very close and regular contact with caseworkers. Other times that's not what they want or need. And so the caseloads is just managed much more dynamically and proactively under the KBOP model. But really, I should let Sarah speak a little bit more to that. I will put a plug for our paper, though, Warren, in terms of the impact on staff, because we can see very clearly that this outcomes focus has taken hold over time at the front line, and that means that there's much more proactive. I forget the term around the survey question, but it's basically to what extent does the participant shape the nature of support, and that really swings up under the KBOP model. But Sarah, maybe you want to come in on this too.
Yep, no problem. So the impact on staff, fundamentally, what we've seen and the feedback from everyone that we're working with is they love working in this way. They feel there's a much greater opportunity for trust, transparency, relationship building. We recruit directly in line with the behaviours. So we recognise the power of the self-efficacy of staff, the innovation of staff, the creativity of staff. If we want to work with people in a strength-based way, we want to enable our staff teams to work with them in a strength-based way. And the staff have really responded well to this. They feel more empowered, more in control, but they also feel that there's an area of safety in terms of trying things. And if something doesn't work, that's okay. And we'll try something else and we'll try something else. To enable us to be that creative, we have to create that level of safety and trust for the individuals that are delivering the service. And as a result, we've seen a lower turnover in terms of people leaving the service. We've seen greater engagement. They're part of our continuous co-design. What do we do? How do we do something better? How do we do something more creatively and inclusively? And also we've supported them in response to the tools that they've asked for to enable them to do this. So we've implemented reflective practice, we've brought in clinical supervision, we've brought in a really open and shared learning space so that everyone can work as a partnership and we're able to learn together. So if one individual does something particularly well, we'll replicate that across the entire partnership. And if one individual is struggling, the partnership will support those individuals in return. So it's been a really, really positive way of working that has had real strength and recognition from the teams that are delivering the service.
Thanks so much for that, Sarah. And I'd really also encourage people to take a look at, we have one other report, well, actually a series report, but one final report that's much more qualitative that was on the KBOP project that I see Candy has put a question in the chat, which I feel like this sort of touches on, of we've got some of this quant stuff about cost effectiveness, value for money, impact, which is really helpful to have in those more hard numbers. But actually, we had those conversations about what was the impact of working this social outcomes partnership and that way of working. So things about market stewardship and collaboration. And maybe I can encourage a colleague, or I'll take a look in a second to pop a link to that report in the chat. But I'm sure that will continue to come up a little bit more in the conversations. We're going with this more person-centered, asset-based sort of wraparound way of working that really shifted from much more fragmented services to something that was much more in partnership. And as I think Sarah and Elle touched on, also shifting away from competition with one another for referrals to being able to really work alongside one another, which is clearly a very different way of working. We've got a few chat questions, so I wonder if I can take two this time. Tim, if you're happy to unmute yourself and ask your question, we'll go to you and then we'll go to Paul. If not, I'll read out the questions from the chat.
Yeah, hello.
Hi.
Yes, I'm just wondering, and if this was mentioned, I had to duck out for a little bit of the presentation, so I might possibly have missed it. But I'm wondering, there's a focus on employment, but I know at the beginning of the project we were looking at, well, can you measure things like, reduced domestic abuse for people who go into a service because of domestic abuse issues? There was some talk about reducing the chaos index, as it's called, for people who go in with complex needs, improving mental health, reducing offending, I guess, reducing drug abuse, that kind of stuff. So I'm wondering if any of that's been tracked, and if there's evidence that those things have improved, as well as just the employment side of it.
Great. Thank you so much, Tim. And then Paul, can I get you to come and ask your question as well?
Great. Yeah. Thank you, Jess. Yeah, thanks everyone for the presentation so far. I just had my question was relating the evaluation costs and monitoring costs. I wondered, and without sort of trying to get exact numbers, but what proportion of that would count as a one-off costs, and what proportion would you expect to sort of be part of the continuation of the program? And are there, perhaps if the exact numbers aren't there on a qualitative basis, are there parts, if the program was to be continued, that you would anticipate that cost to be reduced as it became integrated and adapted based on your learnings? Thank you.
Great, thanks so much. So maybe we can go to Elle and Maria first for like the report sort of angle answer to those questions. But then Sarah, I think it'd be nice to come to you if you're happy to speak to a little bit of that, those questions about wider outcomes, I think especially. And then David, maybe we can come to you after. So I'm teeing everyone up in advance. Just to speak to maybe what looked like different to you when looking at this service, if this felt similar to what other interventions you're seeing, if this seems very different. I think more like the policy angle of like, where you sit in the department, how some of this looks from your side of things. Elle and Maria, who would like to go first?
I can take the first question on additional outcomes, because this is something that we struggled with as well. So being able to quantify essentially these quite difficult metrics around having had been a victim of domestic abuse or having improvements in your mental health. So we tried to proxy the one that was more quantifiable in terms of whether people received benefits for mental health disorders. So we looked at the different codes for the disability living allowance benefit and the personal independence payment benefits. And this, in administrative data, this gives you different codes based on the reason why you are receiving this benefit. And we could identify whether the claims increased or whether they dropped. I will highlight that we don't report further on this because there is very few participants who actually receive those benefits. So there you can see already the difficulty in actually seeing this in administrative data, because it's quite hard to ensure that everyone who is struggling is actually putting that on paper and receiving benefits from government for this. Unfortunately, we were not able to quantify any other issues, for example, being victims of offending or early pregnancy. We don't have any insight on that from the quantitative perspective, that is. I'm not sure if Sarah might have more insights, or Elle, from the qualitative work that we did.
Yeah, maybe we can go to Elle first and then Sarah.
Yeah, thanks. Just briefly, this is a problem that I think social outcome partnerships face a lot, which is they have fabulous outcomes achievement data for the project themselves, but nothing to compare it to, or very limited ability to match it into other government administrative data sets. So Tim, to your point, in terms of the richness of other outcomes data, the project data itself really can speak to some of these questions. And Sarah, maybe you might want to touch on this, but it's our inability to match that into other forms of data that really thwarts a lot of the evaluation and more subtle analysis on this point, because we simply can't pick this up in the admin data. So we've got a bit of a disconnect between very rich understanding of multifaceted outcomes achievement for KBOT participants and then constrained in terms of what the variables look like inside the admin data sets. But Sarah, you know much more about the outcomes that are being achieved.
And I would agree with that. We know the excellence in terms of what we've done, and we know the difference that it's made, but without that comparison, it's very hard to evidence that on an ongoing basis. In terms of the wider outcomes that we achieve as part of this, I can pick up on the domestic abuse one specifically. So of the 6,000 people that we work with, 1,400 of those individuals had been at risk of domestic abuse. And we have a separate outcomes framework that works alongside the KBOP structure, designed by individuals who had experienced domestic abuse, specifically targeted for that empowerment, independence, and the different needs that somebody has in order to stay safe in their home. We use a huge amount of tools to record this and record the impact. So you referenced the tools around substance misuse, but we use the power form and we use the dash. And within those structures, we can evidence the impact of working with individuals. And 75% of the individuals we work with that had been at risk of domestic abuse reported a feeling of increased safety, empowerment, and increased independence. So again, the qualitative outcomes alongside the actual importance of getting somebody into a safe and stable home means they're able to move forward more independently. And it's about what services they can access, what relationships they want to rebuild in their community, how they can become financially independent once more, how they can return into employment. So it's not just directional, it's very, very, very personalized, and all of the outcomes that we're trying to work towards feed towards that long-term independence.
Great, thank you so much, Sarah. David, did you want to come in at all? I think maybe drawing us out a little bit, we've been talking about some of the nitty-gritty, but like slightly from where you sit, slightly broader perspective on some of this.
Sure, thanks. So in a lot of ways, DWP's interest is it how do you help move people towards employment where they have very complex needs? We know that labour market engagement employment rates are very low for a group who struggle with stabilisation, and they need quite intensive input at the local level. But the question for us is, essentially, do you say, well, actually, there's a lot that you have to do before someone can have a conversation or start to think about employment? Or actually, do you start to, or can we start to explore ways where employment can be part of someone's recovery journey, if I can phrase it like that? And if so, how do you start to engage people in asset-based or strength-based ways that Elle talked about, rather than kind of deficit-based ways in the current system? So DWP's interest is saying, well, okay, given that, how do we explore that? Are there projects out there that do start to get closer to whether or not, to understanding whether or not asset-based ways actually do add value here, or whether we talk about them adding value and they don't? And KBOT, therefore, for us, is an interesting project because it explores that question directly for a vulnerable and complex group. I should say, from a DWP perspective, we approach this in a slightly disinterested way. And I don't mean that rudely, and I draw a distinction between disinterested and uninterested. So for us, if the findings hadn't demonstrated that KBOT worked, then that actually is just as valid a finding as demonstrating that KBOT did work, because it builds the evidence base. It tells us something about the nature of these local services. The fact that it does prove positive from a policy perspective rather than a research perspective is quite important, because we can then build on that evidence. But I think we approach this from both a kind of a research side and a policy side as part of our exploration of the potentiality of those asset-based ways of approaching social policy.
Thanks so much for that, David. And I think it's so helpful to bear in mind from different perspectives, what does success look like? And I hope that's part of the richness of this conversation, but also our audience and the questions where you're coming from. And like, feel free to share in the chat as well, like if your perspectives are very different. As I said to the panelists before we kicked off today, we very much encourage disagreement and different perspectives, because actually depending where you're sat, that can all look really different. And so, for example, for David, that actually at a central government level, it is just as helpful knowing when a service isn't working and isn't achieving outcomes as when it is achieving those outcomes. But that measurement is incredibly informative. I feel like we didn't fully answer Paul Atfield's question, but we've also got another question now from another Paul Wafer, who is asking what are the main functions that the KBOP team undertake to support the effectiveness of the service provider organisations? Are the costs of this layer fully built into the model? And our other Paul was asking, as he already put to everyone, a bit more about what of these were original costs and what of these are costs that would be recurring, what sort of like can be learned from. Elle, maybe we come to you first, and then Sarah, I think you had some more to maybe share, especially about KDAS, which is one of these other services that's sort of building on KBOP. Oh.
Yeah, so in short, the costs of the KBOP core team are fully baked into the cost effectiveness analysis. So this is cost effective, thumbs up, inclusive of all of the costs of Sarah and her coordinating team. And something that's come through in our qualitative research is the many different functions that that core team is providing. It's not just about the investment kind of managing the risk. There's a really important coordination role. There's an important advocacy role in terms of what are broader structural challenges that delivery organisations are facing that Sarah regularly coordinates a response to, or is quite proactive in thinking about shared solutions to challenges across the delivery network. So we talk about this kind of ecosystem orchestrator role within Kirklees. And then there's also kind of like some very subtle data performance management work that is being done by that team. So there are a range of different functions coming through, from the sort of structural to the data-led performance management, and that really comes through in our qualitative analysis. But Sarah's team are doing an awful lot of different functions, if you like, but we include all of the costs associated with that. And so our cost effectiveness is inclusive of all of that work. But to Paul's question, how much of the transaction cost might drop away, I guess, over time? Some of that I think we would expect to, because with increased templating and increased kind of standardization around outcomes contracts, some of the kind of the heavy setup costs we would expect to be lower in the future. So I think there's probably some, it would be good to work through more standardized reporting on some of this, but I think some of the work does need to be done on an ongoing basis, but we shouldn't shy away from the costs of doing that important work. Other elements of the cost basis we would expect to see drop down over time.
And Sarah, do you want to come in there as well?
Yeah, thank you. So I've sort of got two thoughts in my head. The first one, in line with the ongoing costs, Elle's got a really good point there, that those potentially will reduce in terms of our coordination responsibility over time, because the idea is that we're changing the systems and the structures across Kirklees, and once we implement all of that, and once we work as a partnership across the entire of Kirklees, so not just coordinating the partners that are within KBOP, we also work very closely alongside prison, probation, housing services, drug and alcohol services, wider community services. Our integration of the importance of the strength-based way of working goes across everybody and works alongside everybody. And as time progresses, our role leading that reduces, because we've created this culture of partnership and this culture of everyone working in that strength-based way, and we've built policies, processes, service level agreements that underpin all of that, and we all work to those same agreements moving forward. I think, just to go back to my previous point around the impact of the wider outcomes, particularly around domestic abuse, I popped Jess a message and I was like, I forgot KBOP, I forgot KDAS, bring me back in. So KDAS is the Kirklees Domestic Abuse Specialist Services partnership that has just been set up as a direct result of the success of KBOP. So because of the benefits and the impact of working with individuals at risk of domestic abuse that was evidenced through the KBOP process, the Commissioner under Adult Social Care and the Commissioner under the communities and the domestic abuse services saw the potential of aligning the partnership within domestic abuse services in the same way as we had with KBOP. So we lead and coordinate all of the domestic abuse services across Kirklees now as a direct result of the success of KBOP. And we're already seeing huge impact in terms of that way of working alongside the DRAM system, the MARAC system, again, replicating that partnership coordination and putting the person at the centre of all of those services rather than being passed around hundreds of different services. It feels like when someone's in one of the most awful and dangerous experiences of their lives, we're there to put that person first, to empower them and to coordinate that approach. And I think that's one of the greatest legacies of KBOP, is that this model and this framework can be adapted to any way of working and to any service. And it's about the principles of working in partnership, working flexibly and working in a way that responds to the individual needs of the person, but also meets those needs of that commissioner and that community. So that structure is just so responsive to any situation that we need to work within. And the learning that we've had of adapting that to the domestic abuse services has been huge and has again changed our thought process with how we want to do that going forward around the system.
Thanks so much for that, Sarah. I think something that's also worth really acknowledging here is this conversation isn't happening in a silo. There's a wider policy context that we're having this conversation in at the moment, which is generally like the strain on local authorities. So even where there's a really great intervention, that doesn't necessarily fix wider problems. There's also a real interest suddenly in central government in some of these ways of working, which I think makes it really worth looking at these questions and really asking these questions in a robust way. Like this year, for those of you who aren't aware, the UK government announced the launch of its Better Futures Fund, which will be a £500 million fund they've committed to doing social outcomes partnerships. They also launched the Office for the Impact Economy just the other month. So this idea of partnering with the private sector to do some of these ways of working. Also the last, I think it was around the autumn budget last year, there was the launch of the Office for Value for Money. And so these questions are coming up a lot, and there's a lot of interest right now that's happening more broadly. However, this work wasn't very easy to do. And I think actually succeeding in getting this, it being perhaps the first of its kind to be able to have a report like this, I think is partly because it's been very difficult. And the fact that this was possible is in part thanks to the wonderful KBOP team and how helpful they were, but also I think the tenacity and determination of our researchers at GoLab, and also the massive support of David and his team in DWP. I wonder if it's worth acknowledging and having also a slightly wider talk about how is it possible to keep doing work like this, like looking into some of these questions. David, maybe you could start by speaking a little bit to that experience of getting some of that access to the data, of making this possible, and making sense of some of that. And then maybe Elle or Maria, you might want to come in with that experience, because Maria was actually technically on secondment to DWP to be able to do this work. David.
Yes, thanks, Jess. It's an interesting story behind how we got to the point where Maria was able to get any results at all, frankly, because the process was quite a long one. I think it's important to say that there are really important principles here around the protection of DWP customer data. It's a very, very rich source of data. We collect in the course of our work an awful lot of very personal information about people, and it's that richness and personal level of the data that allows you to do some of the analysis that Maria and Elle and others were able to do. But that comes with some challenges, because as you would expect, that data needs to be protected. It can only be shared in the right way, at the right time, with the right people. And frankly, there are no prizes for getting it wrong. No one pats you on the back if you inadvertently send very sensitive records to the wrong people. So as you would expect, DWP takes that set of responsibilities very, very seriously. But that comes with some consequences for this project. And I think if I was looking back, the project broadly split into kind of two areas. So one was securing the funding in the first place for this extension of the evaluation so that we could test these quantitative employment impacts, involving persuading the Treasury to give us money through their Labour Markets Evaluation and Pilots Fund, which involved, as you would expect, business cases, discussions of plans with GoLab, agreement with the task force team in the Cabinet Office that looked after all of these processes, and then the agreement for the funding dispersal to make sure that the GoLab team were paid for what they did, but only paid for what they did, not just paid for any old stuff. So we had a kind of set of governance processes around that. But I think the real challenge was then, how do you get the data in Kirklees joined up with the data in DWP? And there was a complicated process around that involving, yes, as Jess said, we couldn't actually give the data out to GoLab to do their analysis. The only way that we could get access was to get Maria and Elle to be secondees into DWP, which involved getting through, as you would expect, security checks and that kind of quasi-recruitment phase, then getting you IT kit, analytical software, and access to DWP systems and the internal areas of the network where those data are stored, then getting you familiar with the data and then allowing you to analyze it. And so there's quite a long story to how that took, and frankly that took almost the length of the project. I think we'd contracted from April to March, and I think it took you until about February to get the access to the data, didn't it? So I don't think we should underestimate the challenges of those, particularly Cav, who's posted in the chat, who's now had to leave us. His team had, under quite a lot of resource pressure with a lot of these types of projects. But they were brilliant in working incredibly closely to say, well, this is what the data looks like. It's not always straightforward data to explore. You can't necessarily analyze it in the software you thought you were going to be analyzing it in. There's all sorts of challenges to overcome in that space. We can explore those more if people want to, but at the same time, I'm quite conscious that talking about behind the scenes data processes is not perhaps why everybody joined the call.
Elle, do you want to come in?
Yeah, thanks so much, David. I think there is a much bigger lesson to be learned around this, which is about all of the support and kind of endorsement from so many different places that needed to come together in order to enable this impact evaluation in particular, but actually that your skills as both a policy person and an analyst was incredibly facilitative for this work. So there's definitely something for the data literate policy person as a key player in all of this.
Maria, do you want to speak a little bit to your experience and maybe also any recommendations we're thinking about this conversation today, we're really rooting it in how do we do cost effectiveness, how do we look at some of this stuff, like what is cost effectiveness in these sort of interventions, value for money, ensuring impact, but actually it's some of these really practical things that make this possible or not possible.
I will have to say a really big thank you to the Employment Data Lab team within DWP, because as David touched on, Cav was previously here in the chat, and his whole team were absolutely brilliant in helping us understand the data, but also get access to very new software under a lot of time pressure to get the results out within a month. And they were under a lot of resource pressure as well. It's a very small team, and they helped us nonetheless get this analysis done. So I think we are incredibly grateful to them for their time and their support. In terms of approaching this, reflecting on all the data challenges that we faced, I think a very core takeaway is the critical importance of good data stewardship and interoperability. So without the legacy providers sharing the personal identifiers, we simply could not have linked the people who were in the legacy service to the administrative data sets and constructed a meaningful counterfactual. So we wouldn't have something to compare KBOK to. We would be missing our benchmark. So good data stewardship from their part was instrumental in making this happen. and equally having access to both employment and wider labor market records across HMRC data, DWP, and House of Ministry data was also transformative because it allowed us to evaluate outcomes in a genuinely holistic way. It's something that's quite rare in public sector evaluations. And that also applies to the value for money analysis, wherein we actually had interviews and conversations with our Kirklees Council team, and they guided us through their cost process, and were able to then eventually bring all this data together to get those estimates. So I think I would just go back to the importance of data stewardship and interoperability for making this actually happen. And of course, a lot of support from everyone involved who were very eager to see this and find out what the results are at the end of the day, and dedicating their time for this.
Yeah, I think one other thing that's worth also thinking about when we're talking about this wider context that I think this speaks to. So we've touched on some of this value for money, cost effectiveness, ways of working, some of the challenges, but it's also, I think it touches on a question that Cavendish asked just before he dropped off about, let's see, what's the exact words? Interested in any of the insights of this holistic approach that could work in other policy areas, such as like mental health provision, working with NEETs and the labour market, basically where there are vulnerable people dealing with fragmented services. And I think it touches on something that's maybe coming in a little bit of Hattie's question as well from the HBGI team, lots of letters there, about this more person-centered ways of working. It's probably worth, first of all, just acknowledging that so social outcomes partnerships, this was one social outcomes partnership, one partnership that was set up under the Life Chances Fund. The Life Chances Fund actually was run by the Department of Culture, Media and Sport. And they had social outcomes partnerships from across the whole country, all working on different life chances thing. But the thing that I think probably at GoLab, but Elle, maybe you can elaborate on this. What we've seen is social outcomes partnerships can hold quite a lot of promise when looking at these areas where other traditional service models maybe aren't working as well, where there's real multiple complex needs, where there's real entrenched issues, where there's maybe some of this fragmentation. When done well, these partnerships can be a really a promising tool for that. And so we have seen them used in other spaces, like around mental health and employment, around children, especially like on the edge of care. And we've got a whole number of thoughts on our websites, but we're also happy, I think, to chat about this more broadly. But perhaps, Elle, I could get you to elaborate on that a little bit. I think maybe about some of the promise of like we can learn from KBOP, but thinking about other areas of policy of maybe a more person-centered way of working. And then my question that I'd like to tee up for the panel, which I think is building on this further, is are there any what's maybe one practical tool or practical recommendation you would give towards being able to do this way of working from where you sit? So Sarah, that will be much more on the ground. David, that will be thinking more of a central government angle, but like your practical recommendation, I think, around this more person-centered or this slightly different outcomes-focused way of working. But Elle, I've given you two things to respond to there, really. So why don't you kick us off before I come to everyone else?
Yeah, thanks, Jess. I think it's really important to acknowledge that just plugging in a social outcomes partnership does not automatically generate this very strengths-based, holistic way of working at the front line. These are not one and the same thing, and they're not easily plopped into ecosystems of support. There's something, I think, to be said about the flexibility of the outcomes partnership. By not specifying what services look like, frontline staff are given the space to think about and talk with participants to shape and tailor what that support really looks like. So as a container or as a vessel for a more person-centered and holistic service, there do seem to be some synergies between outcomes partnerships and this kind of strengths-based holisticism, but that's not automatic. And I think there are other facilitating factors that we really need to think about on that. So I think that's like definitely a word of caution. Like, this is not a straightforward plug and play and you'll have the most person-centered services. That would be an incorrect interpretation, I think, of the findings here. I think, Sarah, you probably have more to say in terms of the spaces within which we can potentially apply more of this holistic, person-centered support. So maybe I'll pass to you for that.
Yeah, I think my most practical recommendation would be the empowerment and the enablement of the staff. So the social outcomes contract gives us the flexibility to work in that person-centered way. And as Elle mentioned, because we don't specify what somebody needs to achieve, we are then able to work with them to understand what their motivator for change is, what their aspirations are, and how we get them there. But I think the fundamentals is to change the approach in delivery. So stop fixing and start listening. Give the staff time to work with individuals to then look at the cause of the challenge that they're dealing with, rather than just presenting the problem. And as such, that will stop people going around the system in a revolving way, as we say, for some individuals. But then give the staff the tools to do that. So implement specific training, implement the space to have reflection, to understand what needs to happen there, remove the administrative burden that might stop someone being able to work in that really personalised way, and remove the administrative burden that categorises the individuals that we're working with. So, for example, one of the things we did at KBOP is we got rid of risk assessments. It's not about what somebody's done wrong in the past. It's not about what somebody can't do. It's about what they can do, what they want to do, and we have safety plans. So in order to do that, we need to know what will keep you safe and what will keep our staff safe. But everything that's happened to you historically, if it's not relevant to where you want to go in the future, we don't need to look at that and we don't need to deal with that. And I would say use the systems and use the data to enable that. And that informs what we need to do and how we need to do it. But on a really, really practical level, if you want to do this successfully, you need to empower and enable your staff to be able to work in that personalised way and have the space and the trust and the time to do that.
I think there's some really helpful practical recommendations that have been put on there. And I think also, Sarah, especially towards the end there, you sort of touched on another question that I think came up, that I see Elle's replied to in the chat about how this model can really enable a more patient way of working and give some more time and space for that, because you're paying for the outcomes, and like that means there's this focus on these longer term things than otherwise there would be, and there's a real measurement of that, and a real credit also, I think, to the KBOT team that outcome measurement was used in a real partnership way to help then do like performance improvement, to really work together rather than like, you aren't achieving this, you're failing, and like we'll beat you up for that sort of stick, rather than carrot. Actually, it was used much more in a carrot way, like this is what matters as a service. And therefore I think that's quite an applicable thing to think about in other services too, as we've sort of touched on, of like measuring what matters, and actually tying some of that payment and that process to that, and then using that as a tool for live learning, for iteration, for the development of services in a really useful live way. Maria and David, maybe we could come to you as well for sort of like your practical recommendation. And clearly you're sitting at very different places to Sarah, who's been very much in the hands-on space. But from where you sit and like the role that you've played involved in this, what would be your practical recommendation for other people thinking about some of this work?
Okay, from my perspective, I think KBOP specifically was actually testing three things here. And we should remember, I think, that projects very often have multiple objectives here. So, we were genuinely testing the data and evaluation approach. Can we get this to work? How do we get this to work? Testing the social outcome partnerships model of how services were delivered. But also thinking more generally about person-centered outcomes, which don't have to be delivered through a social outcomes partnership, as Elle said. I think I've probably got two takeaways, actually. One is quite a short one, which is plan this stuff in from the start. If you think you're going to need the richness of data that we ended up with, make sure that you're thinking about that right at the beginning of the project and building in those systems and governance structures that allow you to get to the end in good time and in the way that you want to. I think the second thing, and certainly perhaps this applies more to a central government than a local government perspective, think about control a little bit here, because rather than highly specifying inputs, you're specifying outcomes. And that inevitably means giving away an element of control, because you haven't got such an ability to determine the inputs that, I want you to deliver the service in this way. I think there is quite an interesting public policy question about thinking that as evidence develops in this field, we are not evidence blind anymore. It's not possible to say we only want these outcomes and we are not going to have any interest in the inputs. So it's how you take the learning from what works in terms of inputs and ways of delivery and asset-based approaches in a way that informs outcome-based partnerships, but doesn't put a straitjacket around them. But it would seem perverse equally to say we're going to take a completely black box approach to the inputs here. We know nothing at all. We just want these outcomes, because the reality is that's not how public contracts are delivered. So I think there's an interesting challenge there as the field develops.
Thanks so much, Maria.
I think my practical recommendation would also touch on something that David mentioned about embedding evaluation from the beginning. So whenever you want to evaluate any public sector reform, you would need to start thinking about this very early and also embed the evaluators in this intervention. Because as you would have understood from the discussion, else insight from the qualitative work that happened before the impact evaluation, the cost effectiveness analysis, they were instrumental in understanding this and interpreting this and contextualizing this. But also from a researcher's perspective, understanding what you're evaluating and if you can identify a possible counterfactual, so what your business as usual is in that situation, that allows you to develop a design-based methodology to evaluate it and gives you a much more critical perspective. So again, it comes back to thinking about this early and, as David said, like putting in the infrastructure from the beginning, both conceptually and practically.
Elle, is there anything you'd add to that, or on any of the other points as we're starting to think about coming back to land, sort of really practical takeaways or recommendations you'd hope our audience would take from today's session?
Sure. I think for those who are interested in further building the evidence, either around outcomes partnerships or around these broader kind of public service reform, something that's an initiative rather than an intervention, being diligent about thinking through what is the business as usual, what is the conventional approach that we're comparing to, and having a data stewardship approach for that is critical. So that's my kind of researcher hat piece. Really, I suppose I should think about the headline here, and I think it's KBOP, compared to more conventional services that preceded it, is more effective and better value for money. So for people working in local government in particular, I posted a link to Emma Hanley's piece, because Emma is on the line, I think, and is the commissioner for this service, shows that it can be done, and it is a great response to services where you are dissatisfied with the current level of performance and whether those services are really meaningful for the types of people that you're aiming to support. So I think that the headline, more impactful, better value for money, and the art of the possible. This stuff can be done and can actively be used as a reform tool.
Thank you so much for that. And last but not least, Sarah, do you want to maybe give you the opportunity as well for like maybe your one final takeaway you'd be keen for the audience to take from the discussion today?
I think my final takeaway would be the impact of the strength-based way of working. And I think the structure of social outcomes partnerships and the importance of relational contracting and relational partnerships within that create this magic environment for all of that to happen. But I think we can see the impact for the individuals, we can see the impact for the communities that we're working with, we can see the impacts in terms of savings for public value for money, but that impact can be a long-term change. But my ultimate takeaway is that strength-based way of working. If we hadn't implemented that at KBOP, if we hadn't changed the approach and move away from that traditional way of working, we wouldn't see the level of evidence and impact that has been evidenced within this evaluation. And where it has had most significant impact is for people that have been trapped in services for such a long period of time. So where the data shows that it's the individuals over 55 that have had the greatest impact here, that is often individuals that have experienced services for most of their lives, lives and have never had the opportunity to consider the whole system and what they wanted to do and how they wanted to move forward in a choice-based way. And we were able to do that by changing the way that we worked at KBOT and using the mechanism of, you know, the social investment and in terms of the outcomes focus with our way of working. I think that was the enabler of change for us. And that's my takeaway, that by putting the person at the centre of what we do, that is going to have the greatest impact for anybody we're working with.
Thanks so much for that, Sarah. And I think it's a really lovely note to wrap this up on. We have certainly been talking about cost effectiveness, value for money. But at the end of the day, we're talking about a service that is about real people and real lives that are getting changed. And that's so important. I think that's probably why most of us are here today, is because we're interested in that and we care about that. And I know that's certainly why we do our work at the Go Lab. And I think there's something that's worth holding in mind with all this conversation about what is value for money with the service. It's also the importance of public value, of like a service actually making a difference and working. It's not just about pounds saved, it's pounds saved while having that impact piece alongside it. And I think this report's a really lovely report for being able to look at that. So I'd very much encourage you to read the report, take a look at the full findings. We had loads of questions today. I'm sure a number of you have more, and there were some that we certainly touched on but could have gone in deeper. So feel free to please reach out to the team. I'll get my colleagues to pop our email address in the chat. John, maybe you can bring up our final slide, please. And so as far as next steps go, as I mentioned, engaging with evidence is part of a wider series. If you're the sort of person who today wasn't just about it as a one-off, but you're really interested in generally what is the latest cutting edge research and what are the practical conversations we can have around those, you can sign up to our monthly newsletter. That's where we tend to advertise them. And the second thing is, if you would like the recording to this session, if you'd like the slides, we'd ask that you fill out the feedback form, and in there you can put your email address and then we'll contact you with those assets. So you can share that with colleagues, you can have a rewatch, you can have a read through those slides in a bit more detail. So the QR code's there, and I think we'll be putting the link in the chat. And as ever, also, we're just very grateful for feedback to know how you found it, what you'd like to have seen more of, if this was useful to you, if this was relevant to your work. It's really helpful for us when thinking about how we do these conversations well. So finally, a massive thank you to all of you for attending and giving your time. We really appreciate it, and your engagement and the really rich questions and conversation that is completely driven by you, our audience. And a massive thank you to all our panelists, Elle and Maria, for the research and presenting it so well and really taking the time to give very thoughtful answers on some of those questions that we looked at. Sarah and David, thank you so much for joining, giving us a real practitioner on the ground perspective and policymaker central government perspective. It massively enriches our conversation to be able to have these different perspectives and these different angles that everyone's coming from. So thank you so much, everyone.